Hi, my name is David Roomer. I am on the board for the Hope Vision Foundation, and I'm going to talk to you about fall prevention for people with low vision. If you would like to learn more about the Hope Vision Foundation or to make a donation, please visit hopevisionfoundation.org. This slide contains the Hope Vision Foundation's logo, which is a solid black dot framed by a turquoise curved line above and a black curved line underneath, which forms a human eye or a person with outstretched arms. Falls are a serious concern for anyone, but statistics show that people with low vision are at an enhanced risk of falling. According to the CDC, 1 out of every 5 falls causes a serious injury. Additionally, 1 out of every 4 people aged 65 and over fall each year. If you have low vision, according to stopfalls.org, you are 2 times more likely to have a fall. What are some of the factors that can place a person with low vision to be at a greater risk of having a fall? Well, for one, when there are hazards like throw rugs, clutter, or electrical cords in the travel path, a person with low vision is more likely to miss such an obstacle and have a fall just like the poor person who is falling on the unsecured rug in the picture on this slide. Thus, it is best to try to eliminate such hazards before a fall happens. Glare is another factor that can cause falls, as glare becomes much more of a concern when one has a vision condition. There is outdoor glare, like the picture with the bright sun shining through the trees. Also, glare can happen indoors, like the image shown of a store with bright overhead lights and shiny white floors. In either situation, it would be harder for a person with low vision to detect obstacles and drop-offs. Reduced depth perception and poor contrast sensitivity often go hand in hand with low vision. The first picture with concrete stairs was enhanced to show what stairs look like with reduced contrast. The second picture with the brown wooden stairs was not an enhanced image. This picture shows just how dangerous stairs can be, as this pathway could look flat if you don't pay attention to the railing and the hill that descends to the beautiful bay below. Many people with low vision are missing part of their visual field, which makes it all the more difficult to detect such hazards. Fortunately, with a little planning, falls can be prevented. The CDC and STEADY, which stands for Stopping Elderly Accidents, Deaths, and Injuries, has 4 recommendations for preventing falls. The first is to speak up. In other words, communicate with your doctors. Let the appropriate people know if you have any concerns with your health, medications, or safety. Secondly, have your eyes checked regularly by an eye doctor. With low vision, you should see your eye doctor once per year or as recommended. Thirdly, keep moving. An appropriate exercise regimen, as recommended by your doctor, will help to keep you stronger and less likely to fall. Finally, make your home safer, which will be discussed further in this video. If you can connect with blind rehabilitation services in your community, working with an orientation and mobility instructor is an important step in preventing falls for someone with low vision. You might ask, what is orientation and mobility? The orientation part is having the skills to know where you are and being able to get to your destination. The mobility part is having the adaptive skills for safe travel, like the person pictured in this slide who is using a long cane to safely ambulate down a flight of stairs. An orientation and mobility specialist is well qualified to teach these skills, as they generally have a master's degree and certification. To be more specific, some of the things an orientation and mobility specialist can teach you are how someone can properly guide you in places like stores. This is called human guide. They can orient you to a route. This can include anything from getting to and from the meal room in an extended care facility, all the way to learning how to take public transportation across town. If you need to cross streets, there are adaptive skills that an orientation and mobility specialist is qualified to teach you so that you can safely complete this task. Finally, there are many tips and tricks for safe ambulation that can be customized for your situation. One common skill that is taught is how to use the white cane, like the one that is being used by my stick figure in this slide. You may wonder, why use a long cane? How can this benefit me? Well, first off, a cane will preview the ground ahead of you, making it easier to detect obstacles and drop-offs. Also, using a long cane helps people to identify that you have low vision, which makes it easier to obtain assistance when you need it. And it helps to make drivers more cautious when you are walking in an area with traffic. In the picture on this slide, a mother who is blind is using her long cane to safely chase her toddler around, who is wearing a child harness and exploring a large room. Some other safety tips that will help to prevent falls include marking the edges of steps with yellow or white paint, like the steps shown on this slide, having good lighting in your home, but also controlling the lighting with curtains and selecting lighting that works for you, ensuring that you have a way to make phone calls so that you can call for help if needed, having railings at stairways, and consider grab bars in your shower and bathroom. Also, as I mentioned, eliminate any tripping hazards in your home. Thank you for tuning into this presentation on fall prevention for people with low vision. If you would like to request more information or training on the topic covered in this video, please visit our website at hopevisionfoundation.org. On this website, you can also subscribe or make a donation. Thank you for standing up for vision.